Bleeding at the dialysis puncture sites is a source of chronic blood loss in hemodialysis-dependent patients. Although it may seem like a simple problem, sometimes it can be quite difficult and time-consuming to manage. It consumes valuable staff time to stop and monitor the patients, especially in cases where there are other chronic conditions like diabetes, high blood pressure, low platelet count, cardiac problems, to name a few. At present, tourniquets and direct pressure is used to stop the bleeding. This can take anywhere from 10 minutes to even 30 to 40 minutes of continuous pressure depending on patient to patient. It is believed that continuous increased pressure may decrease the life of the fistula. Velseal Patch is an optimal hemostatic dressing used to control bleeding post-renal dialysis. The ready-to-use dressing consists of a polymeric hemostatic patch on a non-woven fabric coated with adhesive. The porous PEC sponge of hemostatic patch is impregnated with clot-promoting and clot-stabilizing agents. These constituents are held in the vascular voids of the matrix on the internal surface of the sponge. The blood clotting process starts within the voids of the dressing. The flowing blood comes into contact with the clotting factors in the dressing and they act as a catalyst to initiate the clotting cascade. Further, the presence of a clot-stabilizing agent prevents the disintegration of clot formed. The natural blood clotting cascade continues to the punctured blood vessel without affecting flow characteristics of the circulating blood. When applied, Velseal Patch fastens the blood clotting process by reducing the time required for clot formation. It thereby prevents excessive bleeding post-renal dialysis. Step 1. Open the bag and take out the patch. Step 2. Remove the paper film 1, followed by paper film 2. Step 3. Apply the Velseal Patch immediately after removing the catheter such that the hemostatic pad is over the puncture site and the sides of the patch get adhered to the skin. Step 4. Hold firmly for approximately 4 to 6 minutes or until bleeding is controlled. Features of Velseal Patch: a novel dressing with a polymeric hemostatic pad to control bleeding at dialysis puncture sites. Highly porous in nature and absorbs fluid 12 to 15 times of its weight. Prevents the loss of natural clotting factors to initiate the clotting cascade. Adhesive is non-irritant and gentle to the skin. Specially designed for hemodialysis patients. No secondary dressing is required.